Updated new ACLS Practice Test 2026-25 Pretest Questions Answers. Question 1. What is the recommended compression depth for an adult in cardiac arrest? At least 1 inch. At least 2 inches. Exactly 3 inches. No more than 1.5 inches. AHA guidelines recommend a compression depth of at least 2 inches, 5 centimeters, for adults. Question 2. What is the first drug administered for a patient in pulseless VTach? Amiodarone, atropine, epinephrine, lidocaine. Epinephrine is the first-line medication in cardiac arrest for all rhythms. Question 3. Which rhythm is considered shockable? Asystole, P. Ventricular fibrillation, normal sinus rhythm. VF and pulseless VT are the only shockable rhythms in the ACLS algorithm. Question 4. What is the dose of epinephrine in adult cardiac arrest? 1 mg every 3 to 5 minutes, 0.5 mg every 10 minutes, 2 mg every 3 to 5 minutes, 1 mg once only. The standard dose is 1 mg of 1:10,000 solution every 3 to 5 minutes. Question 5. How often should you switch compressors during CPR? Every 5 minutes, every 2 minutes, when the person is tired, every 10 minutes. Compressors should rotate every 2 minutes, approximate 5 cycles, to prevent fatigue. Question 6. What is the target PETCO2 during high-quality CPR? At least 5 mmHg, at least 10 mmHg, at least 20 mmHg, at least 40 mmHg. A PETCO2 less than 10 mmHg indicates poor quality compressions. Question 7. Which drug is used for symptomatic bradycardia? Adenosine, atropine, amiodarone, dopamine. Atropine is the first-line treatment for symptomatic bradycardia. Question 8. What is the initial energy level for a biphasic defibrillator in VF? 50J, 100J, 120 to 200J, 360J. Most manufacturers recommend 120 to 200 joules for the initial shock. Question 9. What is the T in the H's and T's for reversible causes of arrest? Tachycardia, tension pneumothorax, trauma, transfusion. Tension pneumothorax is one of the T's in the reversible causes of cardiac arrest. Question 10. What is the maximum time for a pulse check? 5 seconds, 10 seconds, 15 seconds, 20 seconds. Pulse checks should take no longer than 10 seconds. Question 11. What is the dose for amiodarone in the first shock refractory VF arrest? 150 mg, 300 mg, 450 mg, 1 mg per kilogram. The first dose of amiodarone in cardiac arrest is a 300 mg bolus. Question 12. In stroke management, what is the goal for DORTA CT scan time? 10 minutes, 20 minutes, 25 minutes, 60 minutes. 9's goals specify the CT scan should be initiated within 25 minutes of arrival. Question 13. What does a sudden increase in PETCO2 during arrest signify? Hyperventilation, ROSC, return of spontaneous circulation, esophageal intubation, device failure. A sudden jump in PETCO2 to 35 to 45 mmHg usually indicates ROSC. Question 14. Which airway device is considered advanced? NPA, OPA, endotracheal tube, simple face mask. Endotracheal tubes and supraglottic airways are advanced airways. Question 15. What is the ventilation rate once an advanced airway is in place? 1 breath every 3 seconds, 1 breath every 6 seconds, 1 breath every 10 seconds, 2 breaths after 30 compressions. With an advanced airway, provide 1 breath every 6 seconds, 10 breaths/min, while continuing continuous compressions. Question 16. Which medication is used for stable narrow-complex supraventricular tachycardia? Atropine, adenosine, epinephrine, magnesium. Adenosine is the drug of choice for stable SVT. Question 17. What is the correct dose of magnesium for torsades de pointes? 1 to 2 grams, 5 grams, 10 grams, 100 milligrams. Magnesium sulfate 1 to 2 G is indicated for torsades de pointes. Question 18. What is the primary goal of the post-cardiac arrest phase? Immediate discharge, organ support and neuroprognostication, starting oral medications, stopping all monitoring. The goal is optimizing hemodynamics and providing targeted temperature management if indicated. Question 19. A patient has a rhythm on the monitor but no pulse. This is called asystole, P, V-fib, sinus rhythm. Pulseless electrical activity is a rhythm without a detectable pulse. Question 20. What is the compression rate for adult CPR? 60-80/min 80-100/min 100-120/min 120-140/min. The recommended compression rate is 100 to 120 compressions per minute.